Go ahead and get started. Hi, Linda. Thank you for that. We have an exciting conversation for you all today. It is a dialogue with UCR School of Medicine physician and Dr. Sorry, I just got a little distracted. UCR School of Medicine physician, professor, medical doctor, and just an extraordinary person. We're very thankful for your partnership, Dr. Jennifer Zamora. And today's presentation is about asthma and allergies and how asthma and allergies, how those conditions, excuse me, how those conditions affect student learning. I'm excited for this conversation because when we were planning this presentation, I told Dr. Zamora I didn't know that there was a direct correlation between having asthma and having allergies and into a student's academic success. So I'm excited to learn along with you all. I just wanted to say thank you for being here on behalf of the Auburn Unified Board of Education. Thank you for your partnership. Thank you for being here. We have interpretation in two languages. We have our Spanish interpretation, Miss Yvonne Rangel. Thank you, Yvonne, for being our interpreter. If you need that information in Spanish, you look up the Zoom tools. There should be a sphere, a globe that says interpretation. If you don't see that, there should be three dots that say more or más, and you can change the channel from English to Spanish. We also have Arabic interpretation with Christia. Thank you, Christia, for supporting us. Unfortunately, Zoom does not have the option for Arabic as a channel. I don't know why. So what we do is we just title it Russian. So if you need this information in Arabic, go to the Russian channel. It doesn't make sense. Zoom needs to catch up with, thousands of years ago. And so with that, Dr. Zamora, I'll hand it over to you. Thank you for being here.
Hi, thank you. So initially, clinically, I was a PA for years in pediatric medicine, almost a decade. Weaved in there, I've done family medicine, urgent care. So I've seen a ton of allergies and asthma from very, very small children up to our elderly. So I just wanted to quickly start off with some pictures. Um, After, earning my doctorate degree in global medicine and health science, I started becoming more interested in community medicine. If you guys ever have the chance to research and look at some documentary videos, they're even on YouTube about the Salton Sea. You will see how much this water is deteriorating, and it's literally an hour and a half up the freeway from us. And so when we get those winds and the Santa Ana's coming through, you guys can kind of see this picture over on the left where I'm circling around it, how much these dust storms can contain a lot of toxic air. Not to mention being in the Inland Empire, let me get into the slides now. We also get the breezes from the toxic air from Los Angeles County, Orange County that come and kind of get trapped in our mountain areas nearby. And so it's kind of like the perfect storm a lot for us living in the Inland Empire. So that's when I discuss Southern California populations, I'm talking about our community where we live, kind of getting both of those effects. And UCR, not only the School of Medicine, but a lot of the environmental faculty are currently looking into this. And Dr. Cisneros, this is the kind of Zoom where after my update, I don't get to see anybody or the chat. It's just my slides. So feel free if there's questions along the way. I'm happy to take them. But I
Okay.
did leave time at the end for more questions and discussion.
Thank you, Dr. Zamora.
Yeah, so I just wanted to give you guys again a quick introduction. There are different asthma mitigation projects throughout California. Um, but if you guys can just quickly view with the cities, you don't really see Riverside County. You'll sometimes see San Bernardino and Riverside County linked together. But I want you guys to get an idea. If you see all of this purple, we're talking not only from Corona and Riverside, we're talking all the way to the end of California, like Blythe area, okay, towards the border of Arizona. This is how massive our two counties are in Riverside County and San Bernardino County that we're dealing with, and we just don't have enough providers. So that's why this is to empower you as parents to know what to look out for your kids. There are simple over-the-counter meds you can start, there are mitigation factors, meaning ways to decrease their symptoms before it gets to the level where, hopefully not, but that they have to go to the emergency room. But at very minimum, have a great conversation with your pediatrician that they should be hopefully seeing yearly for their physicals. So we will be getting again into more of the asthma, how we do a step wise approach, and then an innovative way that we're now trying to intervene on children and their families a lot earlier. So I was part of the first teaching cohort for the Teaching Excellence Academy at UCR School of Medicine. This is where this asthma project kind of was born, and what I fell in love with. And so, working with a researcher over here on my left, this is Dr. Ann Cheney. She knew better about the populations in the Salton Sea area, and she had published already several articles about the toxic dust and the salinity and different things that it really triggers a lot of inflammation in the lungs. And if you guys look over to the right, you could just see, per the whole state of California, the IE/Imperial County area is more than double the amount of emergency room visits for children ages 5 to 17. So that is pretty much a huge health crisis. Several of us have taken mobile clinics, or we've set up in community centers where we were intervening for asthma by checking with peak flow meters. I'll have some pictures coming up on that soon. We've also recently developed a questionnaire. Now, a lot of the pharmaceutical companies did develop their own questionnaires, but they're really only good if the person's already been diagnosed with asthma. And then you're trying to see if their asthma inhalers and meds need to be stepped up, right, in milligrams, or I'm sorry, micrograms, but if they need more quantity of it. And that's pretty much what it's for, whether or not their asthma is controlled or not. But we recently came up with a questionnaire. I have a slide coming up soon where some of the questions are translated into Spanish. But it's good for you guys to be thinking about this for your own children. So again, as we have a lot of the dust particles that arise in the air, especially on a windy day, what happens is once we inhale that through our nose or mouth, but down into our airways, we have something called neutrophil infiltration. So we have parts of the immune system, our white blood cells, that actually come into the area. And within 48 hours, up to 7 days, you can have these inflammatory effects. And I'll have more pictures coming up, but the airways narrow, so they get squeezed down. And then the inside of the airways get really puffy and swollen and inflamed. And that's when a lot of mucus production happens and a lot of coughing happens. And over time, you can actually start to have changes within the DNA if it's constantly exposed to these kind of toxins. Originally, we had a student training model to other students. So we had some PA students that were highly accelerated and really good at asthma start to train our medical students at UCR. And then we would all go out in these big groups and grow the amount of patients we were then able to screen for, because there were more people. Instead of just one provider, there was a bigger team that could actually take out peak flows, take out supplies, and intervene on these asthma possibilities sooner. So as parents, you're like, what does this mean to me? I don't understand peak flows. Okay, so we start breathing right up through our mouth or nose. I mean, the air has to enter somewhere up here before it gets down to the lungs. So if somebody's breathing through their nose and they're constantly itching at their nose, this is actually called something an allergic salute sign. So some of your kids might have a little crease that goes right over the tip of their nose, okay? And that's from them constantly like doing the allergic salute sign or messing with their itchy nose. Other kids might be rubbing their eyes a lot, okay? So then they get puffy. Even if they don't rub their eyes, it's actually a diagnostic sign when we see allergic shiners. So the dark puffy circles under kids' eyes. And honestly, my oldest daughter, for years, that's when I knew her allergies were starting to trigger, is because I knew she'd have a good night's sleep, but she'd wake up with dark circles under her eyes. That's called vasodilation. So you start to have these vessels under your eyes that are opening up to bring more basically immune system cells in because it thinks it's fighting in a war. So a simple allergen like pollen or cat dander or dust mites or something in the air, okay, is affecting your child. And now their body thinks that it's at war, it needs to fight. So it's going to try to bring in more recruit more retroops, is what I'm trying to say, of the white blood cell family, and to bring in more circulation. So that's when you'll have the dark circles and puffiness under the eyes. And for some kids, histamine's being released. So their eyes might start itching, and their nose might start itching and start to run.
Dr.
Here's
Demora, these are signs and symptoms of what?
Okay, so again, these are signs and symptoms of when they're first breathing in, either through the nose and mouth, that we have an allergen,
Okay,
a type of allergy reaction that's happening before it makes its way down into the lower airways.
thank you.
Does that make sense? Okay. The other thing that I educate parents, and sometimes kids are sitting there and the parents don't even notice, but they're like, it's called like a post-nasal drip cough, or they sound like they're constantly clearing their throat. Okay. As providers, when we look in the back of the throat, we'll see these little cobblestones. They look like little bumps in the back of the throat. So we can tell there's been mucus back there irritating the throat. Sometimes the kids complain about a sore throat when all of it's actually stemming from post-nasal drip, from mucus dripping from the back of the nose into the throat. So these are some of your early signs that there's likely an allergy going on, and it's a matter of time before it starts to affect the lower lungs, the airways. So what happens, I want you guys to draw your attention over here, is you have this nice bronchiole, okay? So you can see the little nose, okay? They breathe something in that was irritating to them. And so for somebody, again, it could be cat dander or dog dander. I've had kids after we've done allergy testing tell me, well, I don't have a cat or dog, but I have a rabbit. So I ordered rabbit IgE, which is a type of antibody. And I was shocked because there was a way to order it against fur and against the tail. Well, this kid had a rabbit tail allergy. And so their little rabbit was causing them all of these nasal and asthma symptoms. But say that little allergen gets breathed in, and as it goes down into the airways, you could see the red popping up. It's starting to get inflamed. So instead of being nice and wide and open like this airway, we start to have a closing down, okay, because of the thickness. It's called wall inflammation, and then it thickens. Then, in an extreme situation, the smooth muscles, so you guys can see over here on the left, the smooth muscles are nice and relaxed, and then they're constricted. They like constrict down. You guys might be thinking, why did that happen over time, that our bodies would do something like that? Because it's doing what it can to lower the risk of more irritant coming in. So it's going to squeeze down and try to like hold off that irritant from coming in. Well, in the meantime, just like under the eyes, we have vasodilation. So once was these little tiny vessels to bring blood in around the bronchioles, we now have them thick and wide and causing more blood flow, and so more congestion and more mucus production. That's when you start to see not only a clear runny nose, but once it gets down into the airways, you start to have more coughing up of phlegm. Some kids, so down here in the symptoms, you'll see some kids wheeze, but not all asthmatics wheeze, where you can like actually audibly hear them wheeze. Some kids have something called a cough variant asthma. So they're like like coughing all the time. Maybe coughing fits where it's hard for them to catch their breath. But the worst symptom is if they have a cough that's waking them up at night. Okay, so that is something that we really pay attention to a little bit more closely if a cough is waking them up at night, because oftentimes it's waking up the parents, it's waking up the whole house. Very high likely signs of a cough variant asthma. Now, some kids, dyspnea means shortness of breath. Sometimes they'll just tell you, my chest hurts, or it feels tight, or it's hard to breathe. Or you just might be watching them. They're running around with their cousins, they're running around with their friends, and it's hard for them to keep up. They can't really keep up with the other kids. But that could be a big sign that they're short of breath. They have to take more time to stop and catch their breath. They might not know how to say all that to you, but that's something you could look out for. The other thing is sputum production. Again, are they always like clearing their nose and swallowing? A lot of kids swallow their mucus instead of trying to spit it out. That's going to also create tummy aches. If they're constantly swallowing their mucus, their tummy's going to get full of mucus. I've actually seen kids vomit up lots of globs of mucus, or their stomach just hurts and they're writhing in pain. But a lot of that came from postnasal drip. So these are things I just want you as parents to be aware of. What other things besides allergens? Okay, I mentioned pets, but there are certain medications. Usually we don't give aspirin in a younger child, but NSAIDs, I mean, 6 months and older, that is your ibuprofen, that is your children's Motrin. I mean, they have it for babies now, so that can also lead to worsening in some situations. Usually, some kids might be on a beta blocker for like a large hemangioma. It's kind of like a thickened vascular tumor, or they have heart issues. Kids will be on beta blockers for that, but very common in the adult population to be on those meds. A lot of parents do not think that smoking, okay, they'll tell me, oh, but I go outside to smoke. But all of that cigarette smoke is still in your hair, on your clothes, and that is toxic factors for them. It could still trigger an allergic and allergy reaction. Um, and please don't like smoke directly around them or with the car window up. I literally saw a mom with a teenager in the back with the windows completely up and she was smoking. It was so hard not to honk and like have her roll down the window and say something. So this is where I just try to educate as much as I can when I'm in the clinical realm. Another huge one is weather changes. Every time, like we kind of had that today. We have a few hot days, warmer, the air's dry, and then boom, the temperature dropped by 30 degrees. It's cool and misty in the air. It wasn't like a full rain. Sometimes it can be, but just that weather change alone can actually trigger something where everything kind of vasoconstricts because it's trying to be protective. And then it's hard for them to breathe and they'll start to cough and they'll start to have mucus production. For other kids, it could be exercise induced. So, this traditionally used to be called exercise induced asthma, where they just need a little bronchodilator puff to open up their airways because as they're moving and the air's coming in faster, the bronchioles that I just showed you guys will constrict. Sometimes that happens with emotions for some people. Laughing, fear, anger, stress is another really big one. But for our athletes, we never want to stop them from exercising. We just want to empower them. So usually we'll write for an albuterol inhaler, one to have at school, maybe with, at the office with the nurse. So before they go do to PE or they're going to go to soccer practice, they can go get a puff or two. It's usually pretty good 20 minutes before the exercise to prevent symptoms. Or they can have one at home when they're running around with their friends on the weekend, or maybe in your purse if you're out and you're going to be walking for a long time at the zoo or something. They're going to be around different animal dander, different winds. Then it would be a good idea for you to carry that around for them. And then the last thing is, as kids head through puberty, sometimes we see their asthma symptoms because their airways are now growing, they're stretching, and they're getting wider. We see like 50% of the time, a lot of their symptoms kind of clear up. But for some other people, it doesn't get any better, and some things are actually making it worse. My husband, who's a school teacher at our Lanza Elementary School, did not deal with any sort of nasal allergies until his 30s. So sometimes as we age, being in an environment that's kind of toxic, like I said, our Inland Empire air is, They've even compared our cities to like Beijing, China, these places that get really high smog. We've actually been compared to worldwide as to being very dangerous. And so things like the HEPA filters in the rooms, if you allergy test your kids and see like, okay, they have dust my allergies, let me get the dust covering, for their pillows. It's at Target, to cover their bedding. Let's get more stuffed animals out of their room because that can collect a lot of dust. Blinds that you can wipe down instead of curtains that hold on to dust. Tile and wood floor compared to carpet that can hold on to a lot of dust. There's just some little things that could be changed in the household. Some people get extreme if their kids have been really sick for a long time and will move to a different environment. But there is some things that you guys can do to help. Now, a peak flow meter, it's basically this handheld device. Any pediatrician that you take your kids to can actually write for one. And usually, insurance like IEHP, Inland Empire Health Plan, can actually cover these costs. And then the doctor can help give you how much when they take a deep breath in and blow into this peak flow meter, what should be their target number. Okay. And it's usually based on their height, because based on their height, we know how big their lungs should be and what volume that they can take in. When we turn that into a percentage, we want the child to be able to take a deep breath and blow into the peak flow meter somewhere between 80% and 100%. And it's fine to think of as a grade. We want like 80% to 90% is like your B, 90% to 100% is like your A. But anything lower than 80%, then we realize that this is a non-controlled asthma situation. We want to start intervening with more medication.
Dr. Zamora, we got a question in the chat. It says,
Yes.
how can we ask doctors to check if they have asthma when they think it's allergies?
So again, they go hand in hand.
Mm.
What I like to say is also getting a good family history, because I even teach a lot of students, right? And a lot of medical students, I'm saying, young students too, when I'm on the elementary campuses, that, okay, your mom might have nasal allergies, your sister might get eczema, and you are getting the lung symptoms, right? The wheezing, the coughing fits, the waking up at night. It's all under the same umbrella of a hyperreactive immune system. It's just that mom's nose is affected more, okay, than your nose, and sister's skin is affected more than your skin, but your lungs are affected more. But it still goes hand in hand. It's still all hyperreactive immune system, which is your allergies. And again, that can affect upper airways, and it also can affect lower airways. So I'm back to this original picture from slides ago because I want you guys to know this is where you can be empowered as parents. Antihistamines are very, very safe. Okay. The first thing I've usually started kids on, and this can be dosed down to 6 months old, okay, is the Claritin. They have Claritin liquid, okay, for kids, little babies. They also have Zyrtec for children that are very, very small in liquid as well. Now they make yummy chewable tablets that are like grape flavored, okay? Or they make them in little powders that you can put into a drink. Or if your child's like 12 and they're totally fine swallowing a pill the size of a mini M&M, then again, your Claritin, your Zyrtex will work well. We have Allegra that we'll use if we don't feel like we're getting good results for Claritin or Zyrtec. Now, some parents get confused. Well, there's so many brands out there. Which one do I use? Start with one. Like I said, Claritin. Try it every morning before they go to school for a few weeks. Okay. It might take a few days to a few weeks to really see a difference. If the child has really bad allergy symptoms, okay, and they're still really uncomfortable at night, post nasal dripping, coughing from all that mucus, when they go to lay down, it's hard to sleep. It's fine to also give them some children's Benadryl at night. We've had to do that for kids with really bad allergies. The next step that you can still do as a parent, because it's all over the counter, I'm going to jump my mouse over here to Flonase, okay? We have the nasal sprays that are great for 6 years old and up. We're even having antihistamine sprays now. So Flonase is a corticosteroid. It actually calms several pathways of inflammation in the nose to calm all of this down. And if you would rather use an antihistamine nasal spray, then it's basically having a Benadryl or a Claritin spray for the nose. One other really good thing that's very safe, some parents love it because they love homeopathic, conservative things, is getting a nasal saline spray. Okay. Just like when your kids were babies and you couldn't really give them any medicines and you'd have to do the nasal saline sprays or drops and then suction out their mucus, you can actually still do a nasal saline spray into their nose and then they could blow their nose. And actually, a lot of allergens or even viruses trying to settle in there, it will help rinse it out. And then if you do need to do something like Flonase, then actually the medicine works a little bit better because they don't have all that junk in the way preventing the medicine from working. So again, just wanted to empower you guys on that. The last thing that I will resort to, usually in 12 years old and up, if we do not get any help from the antihistamines and the nasal spray, the third thing I may add is something like in the Sudafed family or phenylephrine family. Now, phenylephrine, one of the active ingredients in like Dimetapp, things like that can actually open up the passages to the sinuses if the ears are feeling really clogged, and it helps dry them up faster. And so that's something that we call alpha adrenergic receptors. They're working differently, but you'll see a lot of combos. Like those of you guys who have allergies as adults, a lot of you take Claritin D or Zyrtec D. Well, that is Claritin combined with pseudoephedrine. Those are the combos that I'm just mentioning that are marketed together because they know it works really well together. Well, for children, sometimes we have to do a stepwise approach and add that at the end if they're not still being helped. Okay, now I want to go down really quick to the lower airways. So if you've already tried everything up here, okay, treating the nose with the allergy meds and the nasal spray, and they're still having some symptoms like coughing fits, short of breath, then we may have to go to something called a short acting beta agonist, which is your albuterol inhaler. Okay, so this is what's considered your what they like to say is emergency inhaler. So this is where you take a quick breath. Okay, Ventolin might be a good example because I see that on a lot of formularies, including like IEHP. But once you take that breath, the smooth muscles that were all tight are going to relax and open up so they can breathe better. If again they're having to use that more than a couple times a week, then they need to be moved to an inhaled corticosteroid. So that would be examples of Qvar, Symbicort, things like that. Where Asthmanex. Asthmanex is nice because it's only once a day. When you get into your combos like Symbicort, like Advair, okay, those are your examples down here, your combinations. They actually have a long-acting bronchodilator, so it keeps your airways open longer. And then the other med can help calm the inflammation on the inside of the airway. So they're actually working in two different ways. And these are kind of the stepwise approach that we will take when we're trying to get control of the asthma situation in your child. One thing when they do take an inhaled corticosteroid, so here's a picture of those kind of examples. Some of you parents might have heard Pulmicort, like when your kids were little, or budesonide. This is a very common medication that if they were on a nebulizer machine and their asthma or their bronchitis was really bad, the doctor or pediatrician may have had you with the albuterol also put in the budesonide, okay, because it calms the inflammation markers. And so those are considered your preventers or your maintenance medicine. Usually I hear both of those used. And we just want it in the lower airways, calming inflammation. We don't want them, just the medicine sitting in the mouth. So usually we'll have them drink some water or rinse their mouth out when they're done. So this is really important that I'm always trying to teach the medical students, and it's good for you parents to learn too. It's called the rules of two. So if they're having, again, 2 times a week where they have to use that rescue inhaler because they feel like they can't breathe, they're out of control. If their asthma is waking them up more than 2 times a month, they're out of control. And if they're having to use a whole canister of a bronchodilator, or sometimes I like to say going to the ER more than 2 times a year, they're out of control. All of those things will require them to go on an inhaled corticosteroid to keep the inflammation calm while you're maybe trying to figure out what are the triggers. Maybe we could do that through an allergy blood test. But either way, it's to really help prevent things from getting further, because children unfortunately still die from asthma. This is still a very serious thing. So if somebody's always puffing on their albuterol, there's something called status asthmaticus, where their receptors in their lungs are so oversaturated with this one type of medicine that everything's swollen up, nothing else is being addressed, and so they're working too hard to breathe. And so eventually the heart gives out because it's been pumping so hard to keep up with what oxygenated blood is flowing around. That's why going on an inhaled corticosteroid is really important, and not to overuse the albuterol inhaler. Okay, so some things that you can ask your child, and I'm sorry if it didn't translate over well or things got cut off, but asking them, is it difficult for them to breathe? Okay, maybe they're not coughing in front of you, but you can ask them, how much are they coughing? Do you hear them coughing at night? Because you're not with them at school all day, right? You're not with them when they're going to their cousins or their friend's house. So asking them, when they're playing with their friends and when they're running with them, is it hard to keep up? Is it hard to breathe? Or do they start coughing a lot? Can you, as a parent, audibly hear them wheezing as well? Sometimes some older kids are able to tell if they have chest tightness or not. But one way to distinguish, because I get a lot of parents confused that they're worried about their heart, is their heart beating fast? Does it feel like it's pounding so hard it's going to come out of their chest? If they don't have any of those symptoms, it's likely pulmonary. It's likely lung related, not heart related. And then again, if you can get a hold of a peak flow meter, then you can really, test them, or they can get tested. If the pediatrics office is not equipped to do it, I've worked at offices where we did all of our own peak flow meters. They may refer you to a child pulmonologist, or they may refer you for your kid to get some of this special testing done. But you, as the parent, have to be the advocate for your child and to ask for these things. So why does it matter that we control this? Because a child who's deprived of oxygen as they're growing up are going to have poor growth. And I had a nephew when this was the case. He was constantly having allergy and asthma problems, just like his mother. When we were young, she was in and out of the hospital with pneumonia. She was always on the smaller side too, but he would always be on his little nebulizer machine, always had to have his inhalers around, always a lot shorter and smaller in growth than the other kids. Now, think about it. If you guys were to get a straw, okay, I'm not sure if you have one near you, but if you get a straw and try for just 5 minutes to breathe out of a straw and see how comfortable you feel while you're trying to learn something new, okay? Or even pay attention to a movie, or pay attention to your kid or your spouse talking to you. It's going to become very uncomfortable soon. So imagine kids that are trying to get their air in, okay? It's going to cause them to feel anxious. It's going to cause them to have meltdowns, outbursts. Like, they can't describe to you that they can't take a deep breath and get it in. And so they're just going to be restless. They're going to act out. They may look like they have rapid breathing. Okay. If you see muscles on their neck, okay, or on their chest being like really in use, okay, we call that use of accessory muscles. That's not normal. That's them in respiratory distress. If you have a young child or a little baby laying down and you see their tummy going like a seesaw, okay, and their chest working really hard, they're in respiratory distress. Later signs can actually be cyanosis. So they could start to look blue, okay, around their mouth, around their lips, or even, on their fingertips. Then we're starting to go into something called hypoxemia. There's low oxygen in that blood. And most urgent cares, emergency rooms, and even pediatric offices should have a pulse oximeter where they can put it on your child's finger and see where their oxygen rates are. I know a lot of you probably got educated with this during COVID, because a lot of times when people were getting sick with COVID and they feel like they were having trouble breathing, they would have their O2 levels checked. Usually for kids, they're between 97% and 100%, okay, of oxygen flowing. But for kids, if they're down between 90 and 93%, we might start getting some of these symptoms that I was just describing. Or if we go down into the 80s, okay, then we're having respiratory distress symptoms. They only have so much time before that needs to get under control, before their hearts are working too hard, and then they'll just go into a full circulatory collapse. So again, as a team, we're going to keep going out there. You can see our sign in Spanish here, but we take out books with us to make it seem not so bad. This is called Breathless Buttercup. We actually have lung models with us. We bring our own peak flow meters to try to help, parents and kids and families understand like what we're testing for and why. But if you guys do, I'm going to take time for questions now, have additional questions or concerns, or not sure kind of where to turn next, I put my personal email on here. And then Dr. Cisneros, I don't know if you could take a few minutes to talk about any sort of resources the school district has. I know that some school districts may have, I've even heard of asthma breath clinics that can visit schools. So I'm going to stop sharing really quick.
Yeah, so that's a very good question. Thank you, Dr. Zamora. First of all, thank you for so much information. As you were going through the exercise with the straw, I pulled one straw out, and after maybe about a minute, I was frustrated. I was angry. I couldn't do it. I can't imagine being a child with restricted breathing. Um, so we do have a couple of questions in the chat. One is more of a comment. Linda says, no wheezing, but my daughter is excessively coughing. And I think you addressed that at the beginning. So when a parent does notice that the child does have excessive coughing or they have the allergy symptoms, what should be their course of action?
Okay, so if they've never had a history of this before and they just got a recent influenza, right? The flu, they got a recent cold, you can actually cough for weeks. That's pretty normal. But are they responding to a children's cough syrup, right? There's so many homeopathic ones out there now, but even Mucinex DM, Robitussin DM, there is children doses and indicated for that. Are they responding to that? Because sometimes just a little cough suppressant and a mucolytic, that's what we call the guafenicin in cough syrup, is mucolytic, meaning it breaks up mucus. Is that enough? Or if we did the cough syrup, is it coming from the nose? So are you hearing again like the like it mostly seems to be upper airway, because that can cause a little cough too, but it doesn't mean the lungs are bad. So you may have to take them in to get listened to, so a provider can listen with the stethoscope to actually hear if there's mucus rattling around. Is there wheezing? But the fact that they're excessively coughing, I'm worried. Are they responding to any antihistamines? Are they responding to any cough syrups? And if not, they may need to be more evaluated to see if they need to be on some inhalers, especially your first line, which is your albuterol or your bronchodilators or your emergency inhalers.
Thank you. Ms. Tamara Holder asked a question. Is headaches over several days while sick a sign of low oxygen intake?
Absolutely. So we have if a child is sick, usually there's inflammation. Okay. There's inflammation markers, even from a strep throat that can cross into the blood brain barrier and cause some headaches. I mean, flu. Think about when you guys have flu. Oftentimes your throat hurts, your head hurts, your body aches. Like it's attacking all kinds of symptoms. But if it's somebody who, sorry, let me put that on silent, although my computer still picks up on text. Um, if you have a child who is supposed to be a lot better, okay, they have some of their energy back, they got their appetite back, they're not really sick anymore. Um, if you have a pulse oximeter, which I've seen a lot of people just order them on Amazon now, believe it or not, they're pretty inexpensive. I would check their oxygen, okay, and see if it's that 93% to 100%. Then you don't have to worry much about it. And a lot of people got educated with this during COVID of whether or not to go into the hospital or not because they can't feel like they could breathe or they're coughing too much, then check the oxygen levels. Um, but yeah, excessive coughing and then yeah, low oxygen going to the brain can also definitely lead to headaches. And then remember they can it could cause them to have decreased learning while they're at school with their teacher or trying to sit at home doing their homework.
Yeah. Thank you, Dr. Zamora. We have Melissa Astudillo raised her hand on Zoom. Melissa, would you like to ask a question?
Hi, yes, thank you so much. First of all, thank you, Dr. Samara, for the information. It's been really eye-opening. I personally have two children with lots of allergies, and my son has asthma. This is new to us. I don't have it. His dad doesn't have it. So it's a lot of it's really surprising because I don't have anyone around me that has it, that I don't have any experience. So I'm constantly finding out new things. And the question I had was, um, you mentioned the rule of twos and not giving that emergency inhaler twice a week, and that was my question because he takes the QVAR daily, twice a day, but he was recommended to do the emergency inhaler twice a week. For like how you had mentioned for PE and stuff. And that's my concern. I'm like, is he getting too much medication? I've noticed that he's had a problem stop growing and stuff. So I'm like, oh, I'm really sad. I don't know how to help him.
Okay, no. So when I say the rules of two,
Mm-hmm.
it sounds like your son already got taken to that next level with QVAR twice a day. So that's the inhaled corticosteroid level. And I just want you to be reassured it's micrograms. Okay. It's very small amounts going to the lungs where it's the problem. The problem is, though, is if somebody's constantly using their albuterol and not on the QVAR, okay, and they get so bad they have to go to the urgent care or the ER or even the pediatrician's office and now get shots of steroids or they have to go on oral steroids, that's actually way worse for their body because that's in milligrams. So we're talking 1,000 times more potent steroids in their system than just on their little maintenance inhaler like QVAR. So actually what's happening with your son sounds like he's right on the right track, okay? Um when an athlete or when he's using it before running, it doesn't actually count. If he's using it as a preventive, so say he has a soccer match to go play, or he's on track and field and he's about to go run the track and he does a puff or two of his albuterol, we don't count that in the rules of two. It's
Oh, okay. Okay.
yeah, it's when they're feeling that they can't breathe, they're in like respiratory distress, and then they have to use that rescue inhaler. If that's happening more than 2 times a week, they're just not controlled. So either the QVAR needs to go up higher in dosing, or he has to go on a combo medication, like I was showing the pictures earlier. Like for young kids, we might do Advair, We might do Symbicort. Again, there's a lot of them that we have used in children when they're not in full control. So just so you know, the rules of two, if you're under a doctor's supervision and it sounds like he's dosing him right, then I wouldn't worry about it. This is for parents who don't even have the idea of an inhaled corticosteroid like QVAR, like what your son's on, that they
Okay.
need to stay on.
Thank you so much. I appreciate it. That helps me out because, again, I don't have a lot of experience. And what you mentioned about the cough actually happened to my son recently, where, again, I don't have any experience with this. He had a cough for 2 weeks, and I'm like, oh, I guess we finished 2 bottles of cough syrup and it's not working. And then I took him to the doctor. They're like, no, he needs help now, like treatments
Yeah.
and pill steroids and all that stuff. So it's good to know. Thank you so much for letting us know, because not everyone knows everything.
Yeah, no, I would say you guys are kind of the role models of doing the right thing, where you tried your over the counters, right? And it didn't work and it kept going on. And so I'm so glad you took him back in, that he got screened, that he got on the right medications. And just so you know, I have a lot of parents worried about the growth, okay, being on a long-term inhaled steroid like QVAR. Actually, the growth is worse if you're deprived in oxygen for a long time.
Oh,
Then yeah, then you're not going to grow. Okay. But a low dose of the steroids, fine. You would rather do that than constantly going on oral steroids or injections of steroids, because then that does affect the adrenal glands. And if it's so often, then that could be poor growth. But, for him, just give him a chance on that QVAR, on his quick acting. And I would also make sure you're treating the nose. So any sniffle, any eye itch, any of those pictures I showed you, make sure he's on an antihistamine. Like, did
yeah.
they put him on Zyrtec or
Yes,
Claritin?
yes, he's on 4 different things for allergies. Because, again, we didn't know, but now we know. Now we know that he has allergies and asthma. So when I saw this thing,
And just so we know, how is he doing? How long has he been on those?
he was diagnosed with asthma and allergies last summer in June, and he's doing good. He's doing good. Just recently he was having a little bit of trouble with that, with the cold air and stuff, and I figured that's what it was, the cold air.
Yeah.
And so I tried at home. The only thing I could try was just warming up his chest. I would warm up like little towels, try to warm up his chest. So even though he's at home breathing cold air, I try to keep him warm, wear like a mask, because he felt like it helped to breathe in warmer air a little bit. So we're trying. We're
Well,
trying,
again,
but he's doing good.
it sounds like you're doing all the right things. And sometimes parents will even run, like, a warmer bath, and just kind of being in the steam water, like, helps them a little bit. Sometimes just changing up the air, whether it's the humidity or exactly the temperature, seems to snap some kids out of it. So it sounds like you're doing all the right things. So I'm proud of you.
Dr. Zamora, we have Mr. Luis Vasquez has raised his hand. Luis, would you like to ask a question?
Sure. So, maybe about 4 years ago, my daughter was having a lot of difficulties with staying awake during class. And fortunate enough, my neighbor was tutoring her, and she's a dentist. So she checked her airways and said that I should really get her checked for allergies, because that might be what's keeping her up at night. And sure enough, I took her in, I got her tested, and we tried a surplus of over the counter allergy medications. Allegra seems to be the one working for her now.
Oh, good.
Uh, but it just seems that from a little bit of time to now, it doesn't seem to be working as well anymore.
Okay.
Because
I'm
she's
I'm
still
really glad you brought this up. Oh, just say your last part.
yeah, because she's having to use her butyl, and she's getting a nasal headaches, like a nasal congestion headaches. So my question is, is it should I continue to give her Allegra, or I mean, how can we go about this? Because
How old is she?
she's 14.
Okay, so she's a really good candidate. You can actually jump through the different meds of the and I know they're going to share this link, but the different products that I had shown earlier at 12 and up, they're totally fine to use a Claritin D, a Zyrtec D, Allegra D that has the pseudoephedrine in there to dry her up, which shrinks some of the swollen tissue, helps dry it up faster, and helps decrease mucus production. But there's something called, I'm going to explain it better, but it's called tachyphylaxis in medicine. It's where receptors get fully saturated. Remember how I said that asthmatics that overuse their quick acting can oversaturate, and then they're not really responding to the medicine anymore, which is super scary. And that's how deaths and ICU visits happen. Well, there's something similar with a lot of meds. So if she used her Allegra and it was helping at first, okay, and then it's not really helping anymore, you can bounce, okay, every few months between Claritin and between Zyrtec and then back to Allegra, because it's almost like anybody in here who's used a different shampoo and realized like, hey, my hair looks so much better, and like feels, like a different product. Sometimes changing things up is actually good. And so I would switch to a different antihistamine for a few months, see if that does the trick. If not, she may be in an asthma flare or an allergy flare, excuse me, where the Allegra is not holding her anymore. So now go to the Flonase step. It's over the counter now. It
Oh,
used
okay.
to yeah, it used to only be prescription. Have her do one spray minimum every morning. Maybe have her do the nasal saline spray to clean out her nose a little bit. And then if those two things aren't working, then step it up to add the Sudafed level or buy the combination of Allegra with the Sudafed. And you should see a big difference after that, honestly.
Okay. Thank you.
You're welcome. I saw another question in the chat about somebody's kid having nasal allergies. Again, if it's only in the morning, it could be a weather thing, right? They're going in from in-house temperature to now they're going into the car or they're going to school. Big extreme, sometimes changes. I mean, I walked out this morning and couldn't believe it was raining. And I had to go back in and get a bigger jacket and a hat. And so kids just right away can start to respond to those kinds of things. And so they still would probably benefit from a morning antihistamine. Again, Claritin is usually my go-to start for kids. But I would definitely try that if it's happening every morning. If it was just for a couple weeks, they could have just been dealing with some residual cold-like symptoms. But if it's been lasting months, and remember, you guys, we've headed into spring. Everything right now, which is so beautiful, is blooming, right? Lots of different flowers, lots of different pollens. We'll have windy days where if your child has ragweed allergy, that stuff can blow in from over 300 miles away. Okay. So this is where you want to advocate for your kids too, and take them and have the pediatrician do allergy panel testing. It's a quick little blood test where they can check antibodies to see if they're having a big reaction to cats, to dogs, the local trees, weeds, grass, foods. The most common foods kids react to are on those panels. And so you can actually get a report. I just got a teenager's report back yesterday that I ordered last week. She has 10 extreme allergies on there, and it's multiple seasons. So grasses for the summer, different flowers for the spring. It's like something in the fall. And so I'm getting ready to refer her because I've maxed her out on every med I just taught you guys. Now I'm going to send her to the pulmonologist, okay? Because she's going to have special breathing tests and see what else the pulmonologist can do about it. But at least we know what her triggers are to see how we can avoid some of those triggers for her. So just know that there's further testing that they could do for your child. Thank you, Dr. Cisneros, for sending the link already.
Yeah, so I put the link to Dr. Zamora's presentation, the Google Slides, in the chat. It just says presentation link. And then I also would like to share my screen to share with our community where these recordings are hosted. So there's a couple of different places. If you've missed any of the recordings and you would like to go back to see, so in the chat, I put in our alfredschools.org webpage. It'll take you directly to our family engagement webinar recordings, but You can see kind of the breadcrumbs here. Go to departments, educational services, family engagement, webinars. So that's one. So they're all here. For example, Dr. Zamora, I think the last one we did together was raising a physically and mentally
Yeah.
healthy child. They're here. So the entire conversation is recorded. Also, if our community would like to check out our Alvord Schools YouTube, so you just go to youtube.com and look up Alvord Unified School District. There are a couple of playlists. And for example, family engagement presentations. Excuse me, let me go back and click view the full playlist. And it's the same thing here. They are available for our community to watch. The last one that we have there was uploaded just last. Hi, Linda. Good to see you here. Oh, it's talking. Sorry. Get started in.
Oh, I think it started playing.
Yeah, I'm talking to myself. I was like, that voice sounds awful. So the last one that's there is a parent's guide to anti-bullying, which we had with 2 school counselors a couple of weeks ago. So all of these presentations are available for families to access if they missed any. And with that, Dr. Zamora?
I think the only thing we need to redo is, because remember it didn't record, is our ADHD presentation.
That was such a good presentation too. Yeah, I know. Our internet died that night. With that, Dr. Zamora, it is 6 o'clock. I just want to say thank you again, Dr. Zamora, for this really incredible and enriching presentation. You saw some really good questions, some good feedback that you were able to provide, not only a broad approach to this, but also some parents asked you for help with their particular children. I've also put into the chat, if you scroll up just a little bit, Dr. Zamora's email. It's jenzamora32@gmail.com. So that's available. Thank you to our community for spending an hour with us to learn how to better support your children. And of course, thank you to the hardest working people in the room, the interpreters, Yvonne, and the interpreter, Christia. Thank you so much, everybody. Have a good night.
Thank you. Have a great night.
Thank you
Bye.
guys for putting this together.